Hello, my name is Suzanne Martin Devroy. I am the Acting Deputy Director of the Office of Burden Reduction and Health Informatics, OBRI for short, at CMS. One of OBRI's most important roles is engaging beneficiaries and the medical community. We do this through a variety of channels with the goal to understand people's experiences, inform solutions, and infuse a customer-focused mindset across our agency and in the work that we do. This is why it gives me great pleasure to introduce our next speaker, Ariel Faber, Chief Experience Officer for CMS. Ariel is our agency's first Chief Experience Officer, and in this role, she leads the design of consistent, connected, and sustainable care experiences delivered across the country with dignity. Ariel oversees the full scope of the CMS Experience portfolio, translating what the public and the agency's workforce need, feel, and value in opportunities to co-create best-in-class products, services, programs, and policies. Prior to her current role at CMS, Ariel was a Presidential Innovation Fellow at the General Services Administration, serving for 2 administrations. She has led federal-wide initiatives, including human-centered IT modernization, digital health, and building a future of work through a culture of care. She holds a bachelor's degree in neuroscience and architecture from Middlebury College, a master's of science in healthcare and design from Imperial College of London, and a certificate in climate change and health from the Yale School of Public Health. Please join me in welcoming Ariel Faber.
Hello, everyone. My name is Ariel Faber. I am Chief Experience Officer in the Office of the Administrator at CMS. It is wonderful to be here with all of you today, and in particular to have the privilege of connecting the theme of burden reduction and customer experience at CMS and beyond. So in my job, I often get asked, what does a Chief Experience Officer do? What is the purpose of that role? So I wanted to share a little bit about the role and also focus in on the theme of making healthcare more human, because at the end of the day, that is really what I see the primary focus of my job being in CMS and in federal government. At CMS, we are very passionate about ensuring that alongside this huge focus across federal government, that we are driving towards better customer experiences in healthcare. And what exactly does that mean? I will be honest, I think the term customer makes me even a little uncomfortable. I come from a background in healthcare and design, and it's hard to think about some of the most vulnerable moments in our lives, some of the best and worst moments in our lives in a healthcare context, and have that kind of terminology used, when at the end of the day, each of us at some point or another have been a patient or have been someone that has navigated a health concern. So in the spirit of being a bit vulnerable and also putting my job into perspective, I actually wanted to share a little bit of a personal anecdote here. So as I have been navigating this job, I have also been navigating my first time becoming pregnant to be a first-time parent. And it is not lost on me that as we think about a future in which across the country, regardless of where we live or what our backgrounds are, that we have access to high quality, affordable healthcare. These are not just buzzwords or requirements. They also go hand in hand with making sure that that care is consistent, it is reliable, it is connected, whether it's digitally or simply knowing where we need to go next and where we've been in our healthcare journey. And it needs to be sustainable. And in my own experience navigating a world that seems quite new as a person who is pregnant, I found that even though I am a person who has the the tools available at my disposal to find the appropriate patient education, to know supposedly where to find the best care and put together the best care team, understand how bills are paid. There have been so many stressors in my own journey that I found myself asking that question: what is this like for someone who does not have the same resources I do? And I think the word that comes to mind through this journey personally and professionally is dignity. How do we make sure that regardless of what our roles in this room are at CMS and or at other organizations, we have a shared understanding of what people are going through at any point in their healthcare journey, and we can make those transitions from one touch point to another as seamless as possible, rather than making it feel like work again in those moments where it might be the best time in someone's life and it might be the hardest time in someone's life. So shifting seamlessly from that anecdote and context, I want to just frame the conversation today with our wonderful panelists that we have here. At CMS, we're striving to design consistent, connected, and sustainable care experiences that we deliver across the country with dignity. And in practice, what that actually means is, first and foremost, making sure that every product, service, program, and policy at our agency has the voice of the people we serve embedded in the work that we are doing, and then translates into meeting the needs of the public in care delivery. I want to take a moment and draw a connection between the terms burden reduction and customer experience, because we might hear those and they frankly they may sound like buzzwords. It may be kind of hard to say, well, what are we actually focused on here? So a few questions that I think are top of mind when we're thinking about improving the experience people have in their care, with reducing inequitable outcomes, and in that process reducing burden on not only people we serve, including patients, but also on clinicians. And we've heard a little bit about that in some of the other sessions earlier today. So holistically, how does this paperwork, this push to have people not only be more active in their care, but also, for better or for worse, be the individuals who have to pull all their own touch points together? How does that impact the ease with which they're able to get what they need? What steps can be taken to address patient experiences, not only in a discrete care location, a hospital setting, for example, or a specific facility, but what does this look like beyond the walls of a facility? What does it look like to imagine care journeys where we are already baking in culturally sensitive, linguistically appropriate considerations? And how can we move towards a future where, when appropriate, the needs of people have been anticipated, and the data that paints a story of what they are going through, both quantitatively and qualitatively, helps all of us across the healthcare ecosystem improve the specific touch points where we may have levers that are complementary. So with that, I'm so excited to dive into our conversation today. And I hope that at the end of today, in addition to our segment here, as well as this broader conference, you all have the opportunity to ask yourselves, how can I make the corner of the universe of healthcare that I sit in a little more human and more humane? Thank you.